I have the privilege of listening to people who are suffering with pain and then using my experience and expertise to help them feel better. My approach to caring for patients suffering with pain is to listen, empathize, and then compassionately with them construct a plan that's going to improve their quality of life. Pain is a challenge in our healthcare system in that there's a stigma attached to it, and there's no specific test which shows someone's in pain or not. Pain is, by definition, a subjective experience, and in opening CPM provided a place where people could be heard, people wouldn't be judged, people could be healed and felt like they were encouraged to get better.
In 2006, I had synovial cyst on my spine. My surgeon removed it along with some bone, and he disturbed my nerves. To say the least, I was in excruciating pain. We found Dr. Grahling was coming to Plainville. My husband says, "Gotta give it a shot." He gave me my life. And because of Dr. Grahling's encouragement and telling me how proud he was that I could go to his appointment by myself and drive my car, and the girls were so proud of me, made me so happy. He's the best. I would never go to anyone else.
I met Dr. Grahling about 2.5 years ago following a very severe car accident. It's really made an incredible impact and improvement upon my life. Everybody that works for Dr. Grahling in this practice is just warm. They are very comforting, they're caring, and we have a personal relationship. It's almost like being amongst the family.
I'm nothing without my team. I get these accolades saying top pain management, this and that, but it's nothing without the team. I'm so humbled and honored to work with such an amazing group of people that come to work every day and just think of others and work so hard together and help people and show compassion and empathy and smile with them and cry with them. And these are things you can't teach. And it inspires me to do the best I can do and be a better person. And we've been able to help thousands of people in the central Connecticut community together as a team, and that's really a humbling, great feeling. CPM has a special place in the central Connecticut community in that we're driven by passion and empathy. With our expertise, can help people along in their story of life. We are a place where if you call, we pick up the phone. We're a place where if you need to come in, we'll get you in that day or the next day. Patients don't wait. When you're in pain, you don't wait. You can't be told we'll see you in 2 months or 2 weeks.
Here at Comprehensive Pain Management, we take a patient-centered approach. We get to know the patient, get to know their family and what they do for work and how pain affects them, not only physically, but emotionally, and how it affects their family. And ultimately, I think the patient gets a great experience, and it's a warm and friendly environment.
When I was in medical school, I suffered with severe extreme social anxiety to the point where I wasn't able to really interact with people, and I was basically crippled in a lot of ways and felt very isolated, lonely, didn't know where to go. Through time and treatment, that's resolved. But that has had an everlasting impact on me and has really fired my soul to try to take care of those who suffer. I've been blessed to be able to coach my son's hockey team. I liken coaching to patient care in ways, in that each young man that I coach has a story, and they have strengths and things they can improve upon. They have dreams and hopes. And as a coach, it's important for me to listen to what they're needing, and then use my expertise and experience to help guide them so that they can succeed in their story. What's important to them, not what's important to me, not what's important to their parents, but what's important to these little beautiful souls. It's the same sort of thing with taking care of patients. You listen to their story, and I use my expertise to help guide them towards healing and feeling well and doing things that are important to them, not driven by other pressures. Patients aren't treated like a number. or a faceless person with an ID card. They're a person with needs and dreams, a family, hopes, desires, and those things are honored and respected here. And we do everything we can to help their suffering so that they can continue to do what's important to them.